Primary healthcare facilities are the foundations of the healthcare system. It is a level at which non-emergency preventive health issues should be managed or resolved. The first level of contact of individuals, families and communities with the national health system is the primary health center. In Enugu State, what are the challenges facing the primary health care? What steps are being taken to surmount the challenges and gaps in infrastructure? Dr. Charles Ojako is a health policy researcher.
One of the common challenges you find in most primary health centers in Enugu State, and of course across Nigeria really, is the issue of infrastructures. And this is more prominent in primary health centers that are located in especially rural areas. Some have completely abandoned the center that they are given. We also have issues about the health workers not being enough. We also found that even the available ones are not always present at their duty posts. Thirdly, we could talk about the issue of funding. Majority of health workers are not properly funded. That somehow compounds this problem.
What is being done to bridge the current infrastructure and personnel gap in the primary healthcare system in Enugu State? Dr. George Ugu is the Executive Secretary, Enugu State Primary Healthcare Agency.
So the issue of infrastructure upgrade and better attention to primary healthcare services has been a priority of the current government of Enugu State, and the evidence abound. Initially, the current administration under Governor Ifeanyi reorganized and reordered the way we handle primary care services by establishing the Enugu State Primary Care Development Agency through the enabling law of the Enugu State Health Service Reform Law of 2017, Law Number 7. From there, the primary health care activity started receiving better attention. I can tell you that initially we started with revitalization and the renewal and the reconstruction of existing primary care centers. That took place in a number of our primary care centers, like the Ababa Health Center, the Ejiliba Health Center, and the one at Ebola.
Beyond the initial interventions, are there further plans to upgrade the primary healthcare facilities in Enugu State? Dr. Ugu further provides perspective on the agency's interventions.
We went ahead to start building a very unique and new type of primary health care, which we call type 3 primary health care centers across many communities in Enugu State. As we speak, over 7 type 3 primary health care centers has been completed, and they are already offering services to the citizens of the state. And while we talk about the type 3 primary care services, is that they are not just the ordinary primary care center. Each type 3 primary care center, you have enough space for male ward, female ward, children's ward, and all that. Then you have a space for theater, and you also have all the basic things you need in a primary care center. In addition, we have where doctors live and where nurses live, because our doctors and nurses in the type 3 primary care are living there and providing services 24 hours. We also have alternative electricity supply. We also have alternative water supply.
And are there steps to ensure the primary healthcare infrastructure are sustainably safeguarded and maintained?
Apart from this type 3, there were other primary healthcare centers in the states that were selected, about 84 of them, to each local government, that were using the Sawmill Save 1 Million Life project. They were renovated and given a facelift. In fact, some of them even got a new borehole, some were re-roofed, some were repainted, and all that. That's also to renovate and revitalize many more. As we are speaking, one primary healthcare center in every political ward has been selected, and the renovation and revitalization work are ongoing, because directly to the facility accounts of those selected primary healthcare centers have already been transmitted.
Representatives of some of the benefiting communities confirmed receiving varying amounts of money for their primary healthcare facility upgrade.
My name is Okeke Vintus from Ojiliba local government. I'm OIC in charge of Oletiti Health Center, Enugu West Central Zone. I'm a beneficiary of Basic Health Provision Fund. I received the first tranche of the money and second tranche of the money. I've received a total of 600,000 from the Basic Health Provision Fund. And the project I was able to execute are 500 gallons of GP tanks. I was able to construct office chair with armrest, office table with side drawer, aluminum window in the new facility. I was able to construct a water tank stand.
My name is Olu Virginia. OIC Abomana Health Center, Izag local government in Enugu West Central Zone. I received fund for the 2 quarters, and I use it to build perimeter fence, big gate, small gate, and door protector. All these are verifiable.
My name is Obodo Patricia. I am the OIC of Mburubu Health Center, Enugu State. Our health center is one of the health facilities that benefits from basic healthcare provision fund. We use the money to replace leaky roof and falling ceiling, and at the same time sinking it. We also paint some part of the health facility and some part of the staff quarters. We also construct one padded office table and one padded back chair.
Recently, an international non-partisan, non-profitable advocacy and campaigning organization that fights extreme poverty and preventable disease, particularly in Africa, through public awareness, among others, One Campaign, recognized Enugu as the second highest performing state in primary health care service delivery in Nigeria for 2019 to 2021.